From the Mumbai studios of Republic TV, it's time for The Debate.
Thank you for joining us on The Debate, and good evening. My name is Niranjan and I'm filling in for Arnab Goswami, who will be back this weekend. The Supreme Court today has asked the centre to start preparing for the third wave of the coronavirus pandemic by creating a buffer stock of medical oxygen. On a day when India has recorded 4.12 lakh cases in a 24-hour period, it's the highest number of cases recorded by any country worldwide in a 24-hour period. And we will look at India's options with top experts on what more needs to be done. That's our debate number one. Tonight we have top experts from across India on the show. 4 lakh cases barrier has been breached once again. And at 10 p.m, our dedicated COVID broadcast Republic team on the ground, the only channel telling you the ground truth night after night. Here are the headlines. India records the highest ever single-day spike in the number of COVID-19 cases, over 4.12 lakh cases recorded in 24 hours. Supreme Court has questioned the centre on the steps taken to control a possible third wave. Delhi Chief Minister Arvind Kejriwal thanks the centre for increasing allotment of oxygen. He says Delhi now getting enough oxygen. Republic questions BJP MP Tejasvi Surya on the controversy in Bengaluru, on a controversy that could have been avoided. The only channel asking him the straight questions. Single dose Sputnik jab out. Russia registering Sputnik Light, which has recorded 80% efficacy. Single dose required, not double. And the unending Bengal violence. Union Minister V. Muralidharan's convoy now attacked. Mamata Banerjee says it's part of a conspiracy. And on top of 9 p.m. as the days pass, it is more and more clear that a third wave is imminent. Government experts are saying it in a government news conference. Top experts are saying we need to do more. And the only question on everyone's mind, are we going to be as dazed and confused as we were at the onset of the second wave, or will things change? We'll ask the top experts on the show tonight.
India has recorded the highest number of cases in a 24 hours period. It's an almost 2% rise in the number of cases.
पेशेंट जो है यहाँ इस गाड़ी में आए हुए हैं जिनकी हालत सीरियस है, और ये पीएमसीएच है, कोरोना वार्ड है पीएमसीएच का, जहाँ पर उन्हें लाकर यहाँ पर भर्ती कराने की कोशिश की जा रही है। लेकिन स्थिति ये है कि यहाँ पर बेड नहीं होने की बात कही जा रही है, भर्ती नहीं किया जा रहा है। क्या समस्या है सर?
हाँ, बोल रहा कि बेड नहीं है, खाली नहीं है, इसे यहाँ पर भर्ती नहीं लिया जाएगा।
From Patna,
situation has gone back to worst in the state of Karnataka, where helpless people are protesting in front of Chief Minister's house and in front of Secretariat demanding beds. On the other side, there is a huge scam of bed allocation in the BBMP, where people are struggling to find beds due to increasing cases of COVID positive in the city and state.
to Bengaluru.
There is a capacity of 500 beds, but there is no oxygenated beds enough for people who want critical care. And we have been witnessing how initially when the admissions had started, there was a chaos outside. But there have been reports like people who have been admitted, they had to leave this hospital because of the scarcity of oxygen. We have been seeing people who have come here for admission, but they are not getting admission. These are the positive patients of COVID-19 who have been waiting here with low oxygen level.
To Delhi, there is a need for strict implementation of measures.
we are here in Charminar. Well, this is one of the tourist spots in Hyderabad where you can see massive crowd gathering here amid the COVID cases continue to rise, but many still seen not wearing masks, no social distancing, and also at the same time we have been seeing that the situation in the state of Telangana and most of the cases are being reported from the GHMC limits, that's the Greater Hyderabad Municipal Corporation limits. But as you can see, massive crowd gathering here.
India has two options: to mask up and get vaccinated.
पहले लोगों को चेकिंग की जा रही, जिनके पास अपॉइंटमेंट का कंफर्मेशन स्लॉट हो उन्हीं को यहाँ पर आने की अंदर जाने की अनुमति जो है वो दी जाएगी। जिसके पास आज का अपॉइंटमेंट ना हो, जो कि 18 से 44 के एज ग्रुप के बीच में जो आते हैं उन्हीं को अंदर जाने के लिए दिया जाएगा। हालांकि 45 के अबाव जो होंगे उनको नहीं दिया जा रहा है, क्योंकि आज का जो वैक्सीन ड्राइव है वो सिर्फ और सिर्फ BKC कोविड-19 वैक्सीनेशन सेंटर पे, जहाँ पर 18 से 44 के एज ग्रुप को दिया जाएगा 500 कोविशील्ड जो कि यहाँ पर मौजूद है। साथ ही सोशल डिस्टेंसिंग का पालन करने को लेकर लगातार अनाउंसमेंट भी पुलिस की ओर से की जा रही है।
But the good news is that slowly the oxygen situation is improving and Delhi is getting what is required.
कल पहली बार केंद्र सरकार ने 730 टन ऑक्सीजन भेजी है। हम तहे दिल से दिल्ली की जनता की तरफ से उनका मुख्यमंत्री होने के नाते मैं केंद्र सरकार का बहुत बहुत शुक्रिया अदा करता हूँ। मैं दिल्ली हाई कोर्ट का बहुत बहुत शुक्रिया अदा करता हूँ। मैं दिल्ली सुप्रीम कोर्ट का बहुत बहुत शुक्रिया अदा करता हूँ। केंद्र सरकार का बहुत बहुत शुक्रिया अदा करता हूँ।
But across India, the concern remains on coordination and supplies as the Prime Minister held a review meeting. What more can India do tonight? Let's debate.
And joining us on the show tonight, Dr. Sameer Dalwai, who is a developmental and behavioral pediatrician and the National Joint Secretary of the Indian Academy of Pediatrics, Padma Bhushan and Padma Shri, Dr. Ashok Seth, Chairman of Fortis and Escort Heart Institute and Head of Cardiology at the Council of Fortis Group of Hospitals. Thank you for joining us, Doctor. Pirus Kambata, who's the MD of Rasna Private Limited, getting the industry perspective on the debate as well. Dr. YK Gupta, President of AIIMS, Bhopal and Jammu, on the show. Good evening, Doctor. Varun Agarwal is the founder of Mission Oxygen and trustee at Democracy People Foundation. Dr. Aparna Jaiswal, who is the Director of Cardiology at the Fortis Heart Institute, also on the show. Thank you, Doctor. And Dr. Hemant Thakkar will be joining us from Mumbai in a short while from now. Just to quickly tell our viewers and our panelists a few news points from this evening. Supreme Court has asked the centre on how they will deal with a possible third wave. Supreme Court has asked the centre to start preparing for the third wave by creating a buffer stock of medical oxygen. This is on the back of the scientific advisor to the Prime Minister saying that a third COVID wave is inevitable. And as the Prime Minister reviews public health response to COVID-19, speaks to different chief ministers. And I want to take my first question with Dr. Ashok Seth. Dr. Seth, when the scientific advisor to the government, Mr. K. Raghavan, emphasizes on social distancing, saying it can exponentially bring down spread and reduce surge as the virus can only go human to human after talking of a third wave, can we continue to have an eyes wide shut approach? And the reason I'm asking you that question is because even today, as states have restrictions, not a complete lockdown, there is a debate ongoing on whether a lockdown is required at all, but at least in concerned areas, concerned cities. Now in the first wave, Dr. Seth, I want you to tell our viewers, we spoke of red zones, orange zones, green zones. Now, this time around, do you see that there is a lack of a concerted approach on dealing with this effectively? What is your view on that, Dr. Seth?
So I'll tell you my view around this. There are 2 or 3 facts that we need to put down on the table, that this is the worst surge that has ever been seen in the world. Secondly, clearly our healthcare system is overwhelmed at this time. The infrastructure is overwhelmed. We see it all the time. It's not just beds, ventilators, oxygen. Even the doctors and their morale is overwhelmed at this time, and let's not forget that. And finally, what do we have to do? immediately whatever action needed is to get over the second wave. Let's not even try and discuss the third wave, which we don't know when will come. We need to get over the second wave. And clearly there is one objective, and the objective is stop the spread of the virus efficiently. We have to break the transmission. Now, there are only three things in front of us to break the transmission, if I was to tell you. COVID-appropriate behavior, we've been pleading around it, we have been persuading people around it, but I don't think that is some way possible in perhaps we're not, one would say, the most disciplined country in the world. And it doesn't seem to get into the people, and we've seen enough examples of that. Secondly, the vaccination, and we're now far behind in numbers of vaccination and their adequacy for times to come. It will take 2-3 months before we even ramp up. We halved our vaccination rate at this time for whatever reasons, and no one's to blame for that. So finally, it comes down to, let's not talk the word lockdown. It brings in two sides of the story. It is a negative connotation, which means imprisonment. Let's say strict regulations, strict restrictions on unnecessary gatherings, crowding, and congregation. Basically, what we're saying is, let's put strict restrictions to enable COVID-appropriate behavior in our country, and that is why I would say that I'm in favor. You can see that many of the states are doing that. Anything which we do now will only bear its effects in 2 to 4 weeks, but the one which will bear its effects fastest is these restrictions on crowding, on gathering, on unnecessary movement, and on congregations. Of course, masking is an important issue. That becomes an integral part of it. We put fines on it. We try to explain to the people. In fact, it is now on to double masking if we got to actually protect others to a 95% more efficacy in protection. And what I mean by double masking, I'm not talking about N95, which if somebody can afford can have it, but also just a 3-ply surgical mask, which costs 1 rupee at this time, and a cloth mask, which can be washed every day, will protect us. Now, if we get these into place, nothing is perfect, I must say. Lockdown or restrictions are not perfect. Behavioral issue is not perfect. Even vaccine is only 70% perfect. But you get these health measures together, you need to do it today, you need to do it now. Otherwise, we would be too late and the propagation may never be stopped. And that is the biggest concern. So the third wave you're talking about could just be a continuation of the second wave rather than even see a trough.
Yeah. And I'll tell you why I asked you that question. Now, I'll cite an example and I'll show you a few pictures, and I'd like Dr. Gupta to come in on that. Dr. Giridhar Babu, an epidemiologist and professor at the Indian Institute of Public Health in Bengaluru, has said reportedly that mostly in winter, sometime in the end of November or early December, we need to ensure that all our vulnerable are vaccinated before the festive season of Diwali. It's important to save as many lives. Now, essentially what he meant was that all super spreader events must be halted immediately. Now, let me give you a scenario. Yesterday, in Ahmedabad, you had those pictures of thousands of people on a ritual. They were misled, right? And today you had, our reporter was reporting from the Charminar region in Hyderabad. Thousands of people still out there. And in the city from where we are broadcasting in Mumbai, between 6 and 11 a.m., when the markets are open, thousands of people are still congregating, are flocking to the markets. Now, these are all gatherings which are happening. You may call it a restricted sort of a lockdown, but people are gathering in different parts of the country, right? Dr. Gupta? So where is the effective restriction then?
I think that is the most unfortunate part. We call ourselves an educated discipline. We don't want that there should be lockdown, but we don't discipline ourselves. Be it
Dr. Gupta, I just lost your audio there. I'm going to reconnect that audio. I lost your audio, so our production team is trying to connect you again. 10 seconds, we'll just connect your audio. I think we had a direct audio line with you. I'll just reconnect that, hopefully getting that back any second. Okay, I'll get you back. Dr. Samir Dalwa, you want to take that question while we reconnect Dr. Gupta?
Can you just tell me what the question is?
Yeah, on the need for effective restrictions to be imposed and to ensure that people don't gather.
I think it's very important to practice what Dr. Seth said and what Dr. Gupta was attempting to say, and we still know that it's the most effective, immediate way, as Dr. Seth said, is to have the personal COVID protective behavior. And like he said, I completely agree with it. The other thing is that two people are wearing the mask, then the chance of transmission is even lesser. But my question is this. These are people, if you have look at it from the person's point of view. You have somebody who is a laborer, and the laborer has to get out of a daily wage worker. It's very easy to fine him and to castigate him and to put him behind bars. But look at the role modeling that we have. Till about 10 days back, we were having elections in the country, and people were attending rallies without masks. So then it's a double-faced thing to tell that poor fellow not to step out because his wife and children are going to be hungry at night. So we have to let's start today. What happened, let's forget it. But let's start with an absolute stop on all political events to start with. It's not necessary to have any of those things. Schools have been closed for a year now. Where is the need to do all these things? So in addition to the measures Dr. said so equivocally, which I support, let's also make it across the board for everybody and each and every person, not just the poor and the weak, to be practiced. That's all I would like to humbly say about that.
Okay. Now, one of the experts, who was on Republic TV in the discussion last evening, he's part of the projection super committee advising the government. Now, he said, Dr. Jaswal, okay, Dr. Gupta, are you getting my audio now?
Yes.
Okay,
yes.
Great. So good to have your audio back. Now, he made a few observations, and let me throw that to you. He said that during the first wave last year, we imposed the lockdown when we had the total number of cases in India around 500. We had a little over 500 cases when we imposed a complete lockdown nationwide. Okay? It worked as the cases were effectively contained. And India still recorded about 1 crore infections in the first wave as we know it. Now, in the second wave, his opinion was that 1 crore new infections have already been recorded in the course of the second wave, and he added that it's likely to peak in the next 2 to 3 weeks. And he said even if you impose a lockdown now, it will take 2 to 3 weeks to show effects. And my question therefore, Dr. Gupta, is an effective containment strategy the only way out that states should have taken or states can take even now than impose a mass lockdown?
I would say today we have to have a multi-pronged approach. One is education, education, education. We have done enough of that. After that, discipline, and after discipline, if people are not disciplined, then fine. It is a criminal activity if people still do not wear masks. If people gather unnecessarily, in spite of knowing that this can be disastrous, this can lead to an economical crisis, a healthcare shutdown, and even after that, they do not understand this is a crime. And to say that lockdown is the only solution is perhaps not correct, but ultimately, you have to break the chain. And if for breaking the chain, limited lockdown or multi-place lockdown or complete lockdown is required, then that will be the last resort. It has to be done. But before that, it is important that we must identify those who are violating it. Put them at the most disciplinary process. Find them exhaustively, put them into the quarantine and see that they do not do it again. I think they are not harming themselves, they are harming the entire community. I think that is not acceptable now at all.
Yeah. Now, let me put the next question to Dr. Aparna Jaswal. Can we take the situation lightly, especially, I'll tell you, there was a comment that came in today, Dr. Jaswal, when scientists have warned that the double mutant B1617 is more dangerous than the UK and the new N440K variant of coronavirus. Now today, the CSIR Center for Cellular and Molecular Biology has said that on record, The scientists have debunked the rumors that the 440K variant of COVID-19 is dangerous in the previous variants. However, they've identified 2 new strains. So every day there are these reports of new strains, and more studies are being conducted in a very detailed manner. And now people have questions. You know, the viewer doesn't understand all of this. Now, but what is certain is that situation is serious, and we need a much more concerted effort to get a grip on it. Isn't it, Dr. Jaswal? Would you say that?
So I think, let me, as a clinician, give you the right perspective that as a doctor, when our sick patients used to walk in before COVID, and when we would lose them, it would be extremely disheartening. And what is it that we're seeing now? We're seeing people in the productive years of their lives are being lost in numbers so huge. I mean, it's unbelievable. As a clinician, ask us what's happening, and in a civilized, developed world, this is absolutely unacceptable. We have to understand that the chain has to break. Rather, I like to use the word, we have to disintegrate the chain, and we have to act now. Wanting to understand that what's going to happen 2 weeks later, or what's going to happen in the third wave, as Dr. Seth also mentioned, let's not just worry about the third wave. We have to break this now. And it's extremely scary what's happening, the kind of calls we get, the x-rays we see, and what's happening in the hospitals. I mean, this has to change. So it's very scary, and I think I completely agree with our previous speakers that we must ensure that the COVID-appropriate behavior must be enforced as strictly as it can be, because the reason that we are in second wave is because we did not follow the COVID-appropriate behavior. We are probably opened too soon, too fast, and too much. And probably our vaccination drive is much slower than what it should be. Unless we act on all these 3 elements, we will keep failing. And I think I have seen Dr. Seth earlier on this very channel, or maybe some other channel, where he has been crying his lungs out, trying to teach people how to wear the simple mask. Let me take this opportunity once again. Please ensure that the mask covers your face with your nose and your mouth, and you hold it back and tighten it. It should essentially be sealed. I think as physicians, as clinicians, we have actually been crying our lungs out. It has to be ensured. It has to be enforced. It is only this way, by following COVID-appropriate behavior, that we will probably be able to bring a halt, along with the lockdown, what we are speaking of. I don't think we should worry about the word lockdown, because we have to save human lives no matter what it means.
Yeah. Let me bring in Piruz Kambata. Piruz, you can't deny that many signs were ignored initially. Of course, it came like a storm. It was a tsunami. Well, you can use different adjectives, but the writing was on the wall. For example, I'll tell you. For example, there was a response in April. We knew about the double mutant strain. In February, we spoke about how 61% of the samples in Maharashtra were of the double strain. We remember reporting about it. It was just a matter of conversation, but the signs were there. Now, coming to what we need to do now, should we have a more aggressive strategy in the next 2 weeks for what is or perhaps can come in the future? Piruz, what is your observation, and what more needs to be done?
See, the big debate now is livelihood and lives, and I am fully sure that lives is more important than livelihood. And industry also is, everybody wants to ensure that this doesn't spread and the chain breaks. Having said that, I think industry, every industry wants to support the government in whatever they are doing. I would also not like your panelists use the word lockdown, but whatever restrictions are required, what doctors advise, what is required, industry is willing to do, and we have to fight this together. I am so heartening to note that while so many negative things are coming in TVs, we also see once in a while how people are spending their hard-earned money on CSR activities, how people are going up front in helping others. There are some very good stories of humanity I am seeing on television.
Yeah.
And I'm so happy to inform you that so many industrialists are also helping the government in finding equipment, in finding ventilators, in flying in personal planes and personal expenses things to ensure to fight. So we have to fight this together. Having said that, and I've been saying from day one, we need to really free this whole vaccination drive. And this should have been done from January. On your channel, I was on record saying on January that vaccination should be, I think, I don't remember, you interviewed me, Arnab.
I think it was Arnab. Vaccine for all. Yeah. We said vaccine for all.
I said vaccine for all from January because that is the only weapon we have. And how we do it, I will tell you. We are the medicine factory of the world. A medicine gets introduced in US and 10 factories are making it. There is an open license. I don't know why all our factories can make vaccines. And there is, in my mind, in such eventualities, there is no patent, there is no trademark. Saving lives is more important than any. If you ask me, I'll say bluntly, forget WTO, forget UN what they think, forget US what they think. We just make vaccines and ensure that 100% of our population gets vaccinated. I'm saying Canada has started vaccine for 12 plus. We should start that also because they say that the third wave is going to affect children more. And the last thing we want to do is to lose our children. And that will be the most painful of the whole thing. So vaccinating is the most important thing. Ensuring that whatever word you call it, lockdown, restriction is there so that we actually really break the chain, that is important. And third, I somehow believe that there should be a total curfew. In every city, there are these hotspots. You showed Charminar, you showed Ahmedabad. I really don't know that why can't there be not a night curfew or daytime curfew in those two. There is no need to open those spots, if you ask me. And obviously now somebody will say, what happens to the people who are working on the street? Obviously, they need to be taken care of. We need impetus. We need to ensure that those people get a assured daily wage. So like, for example, Narega says in rural areas, you get X amount for daily wage for doing what not. Let us announce at least for some time a daily wage for the people who are on daily wage on the streets. So at least the street hawkers and people who are really going to be affected with such restrictions, at least they stay home because they know that even if they don't go out, they will get their 200 rupees, 250 rupees. And our economy can bear it. When our industrialists have become billionaires in what you call COVID, they can afford to really sponsor such people. We need some sort of a money for these people, impetus for small businessmen and traders, so that they don't take the risk. They take the risk, and because of that, others take the risk. We need to enforce it strictly. Only essentials and things required for essentials, export, and all that can continue in a very controlled environment to ensure that it doesn't spread. I think these are the prescriptions which we know, but I agree with most of the participants. We did a very good job in the first stage of COVID. In fact, the world showed us as the India model. But I think the only mistake we seem to have done on retrospect is we celebrated too soon.
Yeah.
I think we should have waited for the celebration till the vaccination would have reached a certain drive. And I think the vaccination and the celebration, vaccination didn't start as much as expected, and the celebration started on the streets, and that is what has led us to this. I think now the only way out is we stop celebrating, we sit at home and let vaccination increase, and now I think that will see the light of it.
Yeah.
Otherwise, I see definitely my biggest problem is that I see that even on a long-term basis, no economy can survive with such diseases. So if anybody is arguing in this room or in any room that economy needs to survive and for that, we can't have lockdowns, I think he's wrong. Restrictions are required. Industry has to accept restrictions. We have to ensure that the people stay home, and we have to ensure safety and life is much more important than economy at this stage, I would openly say. And let us join the government. There's no point criticizing. Let us use whatever measures we have to join. It is oxygen, or it is distributing free masks, distributing free grains, giving doles to people, ensuring that employees are not fired. Whatever we want to do, we have to ensure that more or less the people are taken care of. At this, what I call times where, I don't think any world or any country has seen those times. We have to be together to fight this.
Yeah. Firoz, just responding briefly to what you said, as far as the contribution of the industry is concerned, every day here on Republic, we have this initiative called Stay Strong India. And as part of that initiative, we are highlighting how individuals, companies, Samaritans are coming forward. So a large chunk of our, broadcasting time we are dedicating to that on a daily basis, and we will continue to do that. And let me bring in Varun Agarwal.
Just a minute, Niranjan. Can I just have 1 minute?
Sure. Please go ahead, Doctor. Okay, go ahead.
I just wanted to say that whenever a lockdown is talked about, there's only two views to it, either livelihoods or lives. And we never look at, and the reason for that is because in the first lockdown, the poor, the needy were forgotten to some extent and suffered a lot. Now, whenever we talk now, and we talk about restrictions, and we talk about institution of restrictions on gathering, etc., we're actually, what we're saying is there's neither an extreme right and neither an extreme left. The moderate path in the center of doing exactly what you need to, and then looking after the poor, looking after the needy, looking after the marginalized, are the ones which are needed, and it's easy to institute because this is the time when we don't want to be on the two extremes and we want to get the best. And finally saying that let's first penalize them and let's first put them into jails is not practical. Our vaccinations are not working and may not be ramped up for a few months. Persuasion and any amount of talk that we do about masking and avoidance of gatherings, etc., is not being heeded, and that's because poor examples have been set. There is COVID inappropriate behavior happening every day. And so we left with the actual imposition of restrictions in a very strict manner for unnecessary gathering, crowding, congregations, call it whatever, but it's not a matter of debate, it's a matter of equal understanding.
Yeah, speaking of equal understanding, we had some good news today. Good news in terms of Delhi getting enough oxygen, and the Chief Minister of Delhi acknowledged it, even thanked the centre. Now, it's come after a lot of debating, a lot of arguments, a lot of, finger pointing. Varun is the founder of Mission Oxygen and trustee Democracy People Foundation. Varun, what is your observation and what is your comment on this battle for oxygen? And to take it forward from where Piru said, industrialists playing a huge role in mobilizing this oxygen. Industrialists, people on a daily basis. Everyone doing what they can in ensuring that Mission Oxygen is a success in every city across India.
I think it has become very important and a collective effort for the entire country, all the industrialists, all the hospitals, everybody to come forward, and they are already working in sync now. Right now, we started this initiative, Mission Oxygen, almost 10 days ago, and we did not plan it to be such a big mission. We initially thought out we only will get 500 oxygen concentrators, and today we have already placed orders of more than 6,000 of these from China. We have already distributed more than 1,000 of these in Delhi NCR region. But what we have already understood by speaking to all these different hospitals, government hospitals, private hospitals, nursing homes, the requirement is far too much. And in our data bank right now, what we have received a requirement of more than 20,000 oxygen concentrators from Pan India. And this is where what we feel is important now. We are not going to stop here as Mission Oxygen. And what we are going to do now is we are going to look into other things like setting up oxygen generation plants. We have already been in touch with a lot of different government facility organizations, and we are already assessing if we can help them set up these plants. We plan to set up 50 to 100 different oxygen generation plants in the next few months, and we have already done one of them. We have already set up one plant in the Deen Dayal University Hospital. We have already done that, and we feel setting up an oxygen generation plant is a process which will actually have the benefits in a long run. We are setting up oxygen concentrators right now. Probably this is something, it's a firefighting exercise what we are doing right now. It's a crisis. We are going out there, we're buying, we're putting out because this is what is needed. But to sustain the second wave or the ongoing wave or the third wave, we have to systematically create that infrastructure around the hospitals so that we are not dependent on such systems of these portable oxygen concentrators. Because going forward, what we have understood, we spoke to Telangana government. We spoke to in UP many hospitals. There are many hospitals who have the capability to set up these oxygen generation plants, but right now they're too focused on the calamity on their hands right now. And we, as Mission Oxygen, we have taken this initiative that we are going to help them put up these plants, because these plants probably they start from a range where you can help them suffice 20 beds going up to 100 beds. And now if these oxygen generation plants are able to take that much load from the hospitals, then that much oxygen can be provided to the nearby hospitals at one go. So this is not a battle which can be won today. This is not a battle which can be won probably in a month's time. It's an infrastructure related issue which has to be sought out, which we need all collectively. Everybody needs to come in together and sort it out. All the other speakers, they said that it's right. We need to impose restrictions. We need to set everything right. But that is exactly what we have to do right now. But at the same time, we have to rebuild the infrastructure so that even if there is a third wave, there's a fourth wave, there's a fifth wave, we are ready for that. Yeah. Because this is the process. This is what we have to do now.
Yeah. Dr. Hemant Thakkar is also joining us on the broadcast this evening. Dr. Thakkar, some good news came in this evening when we broke the news of Sputnik announcing the single-dose Sputnik Light, as they called it, Sputnik Light with 80% efficacy. Just one jab is enough. And a lot of, the reaction in the newsroom was fantastic. Everyone was very excited. So, on the vaccines, where do you stand, and how do you see things panning out? Has it improved in the last few weeks, or are we at exactly the same position where we were?
No, we are not at the same position, but the fact remains that we are short of vaccines. Now, it's useless grumbling and procrastinating that we are short and somebody is at fault. We need to find out and look at measures how we can get more vaccines. My question is, if oxygen could be fast-tracked to Delhi and other places, why can't we fast-track vaccines from overseas? I know that Pfizer had applied for licensing in December, and the newspapers tell me that they've even applied now and they're looking for the waiver. I think a waiver should be given quickly. The Sputnik, which has landed from Russia, also should be allowed to be cleared quickly. I know that in these catastrophic times, customs, duty, paperwork, everything has to be waived. Ventilators have to be flown in and delivered. They don't have to sit in the customs. Vaccines that are available, we know that the US is sitting on extra doses. We should get them here quickly and distribute them. Now, the modus operandi of distribution, of course, is very much dependent on the center, how they wish to do it. But I think a time has come when people should be given the choice. If they want to spend money, like somebody said, a remdesivir costs 3,000 rupees an injection, or used to cost. And if you have to pay that much for a Moderna or for a Pfizer or for anything, they should be allowed to pay it. Because you have the right to buy the quality of your life.
Yeah.
If I can wear a PPE or a double gloving or a triple masking, I should be allowed that. Having said that, we should also look at other infrastructural changes. It's useless epidemiologists telling me that we're going to have a third wave. You should start looking at medical colleges. You should waive those millions of exams that aspiring medical students have to appear for before getting in. And marks have to be counted, and re-exams and entrance exams. Today, children of doctors do not want to become doctors because of the immense number of red tapes. Then you have to sign a bond that you have to work in a particular area. If you are anticipating a wave, fast track that. Get medical graduates on path. Get nurses on path. Tell pharma companies to give pharma companies licenses. Do not sit on rules and regulations. Oxygen is being for today, but we will need drugs for the rest of our lives. Hopefully, with good vaccination, pressing the accelerator for vaccination, we'll be able to curb, tame, or even harness the third wave. So which vaccine we use is not important. As Anthony Fauci has said, you have to use a vaccine. 65 to 70% of protection you will get. Open up the vaccines. Offer a garden variety. I'm not saying that people with yellow ration cards, where we treat them as indigent in our hospitals, where we allow them all the facilities that a paying patient gets, should be charged. Let us give free service to the deserving. But the people who might want to buy it, who have the wherewithal, let them do that. At least my caseloads will go down. I have people who want single rooms and people who want general wards. So people who want single rooms in hospitals could have bought the higher and more expensive vaccine. My plea is give us more and more vaccines. People are valuing their life, not the value or the cost of the vaccine. So if the government were to flood all this, that will make a big difference.
Yeah. On a lighter note, Dr. Seth wanted to respond, and Piruz also, I see Piruz also, raising his hand. Dr. Dalwai also wants to come in. On a lighter note, a few weeks back when we make the news list for the next day here on the news desk, there was a story that came in, a very interesting story of an Italian wanting to fly to Russia to get the Sputnik jab. Now we're seeing in India, if a lot of people, I'm telling you, we know of people who are willing to fly to get the RT-PCR, even if it takes 48 hours, wait for the test to come in, and then book a ticket, go to another city, and get the vaccine dose. It's actually happening. It's actually happening. Dr. Seth wanted to come in, and then I'll let Piruz take that.
I mean, the vaccination issue is very important, and just to address two aspects. One is a hard infrastructure. We've been till all this time talking about soft infrastructure. Let's just build some, temporary sheds. Let's just put some beds into it. Let's put some machines into it. We haven't even talked about the doctors and the morale and how do we maintain the emotions of the doctors. They're actually getting emotional exhaustion. All that has never been talked about. So it's all soft infrastructure, and India won't progress unless we have the 4 pillars of infrastructure rightly into place. One is the hard infrastructure. We talk about beds, etc., equipment, so on and so forth. The second is what Dr. Hemant Thakkar measured. Doctors, nurses, how do we actually ramp those up in a very systematic manner? But let's not forget 2 other important pillars. And that's why I'm not dwelling on what Dr. Thakkar said. He said it eloquently. The 2 other pillars are putting money into indigenous manufacturing and promoting indigenous manufacturing. That's the 3rd important pillar. Creating it simple, single window issues. I mean, we talk about it a lot, but every time I talk to my colleagues in the industry, it's still a hard task for Indians to manufacture in India. And finally, look at research and development, something which has never been addressed. United States put $2 billion right up front into creating these 2 RNA vaccines. They promoted it. It was an integral part of their mission. We somehow seem to sit back when even a small amount of money is asked of us to say, how do we increase the manufacturing capacity of the very companies who we rely on for the vaccine? And yet we have reluctance to even forego that much of money to encourage that. I think R&D has to be a responsibility of the nation and not just a few companies who put in a lot of money to get us valuable drugs and vaccines for our safety. These 4 pillars, I was going to say, are extremely important. And then you said about what other aspects. I do believe that when vaccine has to open up, there's no point having X number of hospitals and X number of places. Vaccines only proliferate when it goes down to every general practitioner being able to give you a vaccine. So ramp up manufacturing, but make it so simple that I can walk into my next door clinic and actually have a jab because that's what's available at every 200 meters or 500 meters. That is how vaccinations are done, and that is what India will need. The fact that you've got to wait 30 minutes after a jab is gone after 15 crores of vaccination. Nobody is having those side effects. There is no reason to have these centers and supervision and so on and so forth. Even a nurse is giving you a jab, and there's no reason why in your own clinic, in your own colony, someone can't give you a jab and you actually had the vaccination. So that is the way we've got to move ahead. That's the vision for the next 3 months and 6 months, and not these creating mega centers with queues of people standing saying, let's go to the COVID app, and that's the only way we'll get a vaccine. We will be doing this for the next 5 years, I think.
Yeah, okay. Samir wanted to come in. Quick intervention, Samir, and I'll go across to Dr. Gupta.
I really agree with Mr. Kambata that restrictions will not work unless the poor or those who do not have the means to support themselves, like the rest of us here, are supported. And hence, the Maharashtra model, which is being spoken about now, did that because it was announced that even rickshaw puller drivers and cab drivers and though the hawkers will be paid some money every day. So I agree with Mr. Kambata on that. The second point about vaccines, the Indian Academy of Pediatrics has been persistently following up with the union government, allow pediatricians to vaccinate everybody, allow pediatricians to vaccinate adults, because we already have a cold chain in our clinic. And the point that the gentleman just made about half an hour, when the pediatricians are used to vaccinating, and the people are very happy and confident about the pediatricians vaccinating. The third part is, yes, I agree about the customs restrictions and allowing hospitals to proliferate. But let's not forget the poor of the country. For them, it's the government and the municipal hospitals. If the nation spends 1% on health, the corporate hospitals may do well. I am attached to a corporate hospital, so my practice will do well. What about the 50-60% of the poor in this country who can't afford that? They will follow in the same cycle. So we need to look at that. And finally, what I'd like to say is about children being a pediatrician. We are worried about children, and rightly so, because they form 40% of the population, which by and large so far has not been infected nor vaccinated. And hence this so-called third wave is bound to come in, because it's not really a wave. It's when finally the last 40% of the segment is the only vulnerable population left. So we need to ramp up vaccination for everybody, including children, allow the Indian Academy of Pediatrics to do it.
There is some development on that front, and let me put that question to Dr. Gupta. If I'm not wrong, Canada has already started to look at that option. And the Bharat Biotech chairman, Dr. Gupta, the Bharat Biotech chairman, Dr. Ella, who was on Republic, he spoke about how his vaccine is safe for children. Now, they're looking at the possibility, they're waiting for approvals, it's going to take some time. But taking that point forward of what Dr. Dalwai said about how children will be the only ones who will not have received vaccination in a few months from now, and they're vulnerable. They will be vulnerable, isn't it?
I would say a few things about, and I may be different with somebody what he said. See, vaccine is a must for every citizen. Vaccine hesitancy was created by public, by doctors, by medical profession also. And it is important that when you introduce a new vaccine, all precautions must be taken. It cannot be said, it should never be said that no precaution, no caution, everybody should get it without any observation, without any. And that's why AEFI, Adverse Event of Monitoring, is very important. Because at any stage, the safety should not be compromised. And that is why we did not recommend them for children initially. Now, when the safety data will be available, then you do it. Second thing is vaccine. Initially, it was vaccine hesitant. And everybody in your media and everywhere were trying to remove this vaccine hesitance. Now, we should not, at initial stage, deprive people because of cost. It is the fundamental right of everybody, every citizen to get the vaccination. It is the duty of the state to give the vaccination. Now, when you have sufficient quantity and when you have a choice, then you do it. But before that, let everybody have the right to do that. Number three, that time is not yet come when you can make a choice. Let that be when you have plenty of vaccination available in the market. Then let them make a choice. But if at this stage we say, no, you have, then people will again go into the same confusion. Are bhai, hum Covishield le, ya ye Covaxin le, ya Sputnik le, ya Moderna le, ya hum Pfizer le. Are bhai, let this confusion be rest for later stage. But first thing is, educate people to take vaccine. We are still not educated for that. And the second thing is, I must say about the preparedness. Preparedness for oxygen. And that is where we must work. And when we say it's first wave, second wave, third wave, fourth wave, and when you look these waves combining together, it will become a flat. That means this variation will happen always. And I must also tell one thing. When we say mutation is a constant phenomena for virus. Mutation does not mean that every mutant is dangerous. It can be non-harmful. It can be less. But whenever there is a mutation, to say that this mutant is at a much 10 times, 20 times transmissibility, virulence is high, the genomic surveillance is important. So that's why that type of infrastructure is also important.
I have 3 minutes.
To create our health sector very, very strong in future.
I have 3 minutes. I want to get in, Dr. Jaswal, Dr. Thakkar and Piruz. I'll give them 1 minute each. I saw Piruz raising your hand and Dr. Jaswal also raising your hand. Okay, Dr. Jaswal, taking off from where Dr. Gupta, and I'll go across to Piruz next. 1 minute to you, Dr. Jaswal.
Exactly from where Dr. Gupta left, I want to say that we have to essentially ensure that we have mass awareness campaigns for vaccinating people. There still is a hesitancy in the lower, especially lower socioeconomic strata of accepting the vaccine. That was one. And second, we have to formulate innovative ways of delivering the vaccine. It could be with the help of mobile vans. It could be with the help of utilizing government schools. It could be more innovative ways, but I think we have to ensure that hesitancy towards vaccine is diminished and we have mass awareness campaigns for this. Only then can we move ahead.
Yeah. Piruz.
See, my quick point is that in this whole controversy, I have seen one thing, that everything is important. Ventilator is important, BiPAP is important, oxygenator is important. So my question is, where is Atmanirbharta? So I think if we are to really ready for the next waves, we really need to first have a medical industry which is Atmanirbhar. We say, okay, we manufacture some medicine, but the key material has to come from XYZ. Without that, we won't manufacture. So I somehow believe in this thing. One thing is we have learned is that we really need complete Atmanirbharta in whatever we are doing, including vaccines. And I strongly urge that forget licenses, all the units which can make vaccines should be allowed to make vaccines in India, and let us vaccinate everybody 12 plus. And let us send plane loads, let us forget bureaucracy. And I've been saying this is the vaccine for all campaign of Republic TV from January. That is the only way to come out. And last and single point, lot of donations are happening, but unfortunately on donations also GST is being paid. So if I buy a ventilator and give it to a hospital, I am not getting input credit because my trust is buying it, and I am still paying GST on it. The input credit is not got by the hospital also. So actually this is a donation tax. So I strongly urge the government through Republic channel and many other channels, don't tax donations. This is not the time to tax. Please make all medical equipment for COVID for donations and charity coming from abroad as donation or bought completely IGST free. It will help everyone.
Okay, we'll take this clip of yours and tweet it so that they take note. And I think there are some measures being taken to that effect. And I hope that whatever you said also is
No, I have checked it. It is because of our type of campaign only. Only if it is donated, there is no GST.
Got it.
A lot of us are buying and donating.
Got it.
So if donated is no GST, but if you are buying and donating, GST is there. So that is the catch. And I think my friend who is part of the Oxygen Mission campaign will agree with me that people who are donating also are paying tax.
Yeah, Dr. Thakkar, last word to you now. You know, one of the concerns of vaccine makers was also about the mutants. Okay, you want to come in? We want to say something. Make your point. I have very little time, so go ahead and make your point. Dr. Thakkar.
Basically, what I want to say is, why are you looking at the exclusion criteria? Why are you looking at the exceptions? The vaccine is against the corona family. The corona family makes the mutants. So you are only an offshoot of the parent molecule. If you take the vaccine, 70% protection is guaranteed. Even if the mutant gets you, it will be milder. You will not succumb to it. Why should we keep placing riders and talk about mutants? You haven't even taken the vaccine to begin with. I think there should be incentives. People getting jobs if they have vaccines. Teachers getting admissions. Anybody getting a cheaper train ticket or a railway pass. The vaccination should be the qualification point. The carrot and stick approach has always worked in our country. Vaccination should be a must for anything. Like you have a PAN card, you must have a vaccination card. And my last line is, all said and done, the mask is still your best friend. If you want to worry about the mutant, you vaccinate and wear the mask. Don't give up the mask, is my message.
Thank you, Dr. Thakkar. Dr. Sameer Dalwai, Dr. Ashok Seth Piruz, Dr. Gupta, Varun, Dr. Aparna Jaswal and Dr. Thakkar. Thank you for joining us on the show tonight. Thank you very much.